I am doing my skills video today. I have the questions that Miss Cisco emailed us. I just printed them off so I wouldn't have to keep referring back to the email. So the first question is, what are some important assessments to make regarding NG tube management? So regarding management, I want to start with the most invasive thing to my patient. So I will look at the abdomen first. I'm going to look, listen, and feel. Looking for any distension, listening for bowel sounds, and then I'm gonna move on to the suctioning equipment, making sure that the problem's not there. I'd turn it off and on if it's still not suctioning. I'm making sure there's no kinks in the tubing, making sure the tubing is connected properly. I'm then going to check placement of the tube. I would first start in the nose. I'm going to make sure that the tube hasn't accelerated further into the nose or hasn't come out, looking at the marking that it was initially made by the nurse that placed it. If that's all right, I'm then going, or if it is where it's supposed to be, I'm then going to check the placement by the pH. I would then make sure suction's turned off, and I would get a syringe. I'd pull back about 5 mLs and place it on the pH stick, and I want it like at a 7 for the gastric pH, and if that's right, then I can move on to placement verifying with an x-ray, and the x-ray is going to be the most, what's the word I'm looking for, the most accurate placement verification form to use. So I've checked the placement of the tube and it's still in the abdomen. Maybe the tube is clogged. So now that I know that where the placement is, I can now flush the tube. I will first draw up 30 to 40 mLs of normal saline or tap water. I'm going to hook it to the tube, not the blue, because nothing goes in the blue. I would if it's stuck, I can do like a little plunging motion with the syringe, trying to like loosen it up. But then I want to, once it's on, I'm gonna push it all in. And I do want to count these as INOs for my patient, or document as INOs for my patient. So I think those are the most important steps regarding NG tube management. What ways can NG tube placement be verified? Name the steps of verifying NG tube placement by pH verification. What are the steps for flushing an NG tube? Okay, I kind of answered those, but let me just answer them again just in case I missed something. So the steps by verifying, like I said, the nose, I want to make sure that the tube hasn't accelerated further or hasn't come out. I can check that by the marking that was initially made by the nurse that placed it. I would look into the documentation and how many centimeters it's supposed to be at. Once that's verified, I can do the pH. I'll draw back about 5 mLs, place it in a basin with the pH stick. I want the pH at a 7. What are steps to flushing? So flushing the tube, I first have to verify placement before I put anything into the tube, any flushing or any type of fluid down the tube. I need to make sure that it is verified by the nose, by the pH, and by a chest x-ray. What are the steps for flushing the NG tube? So flushing the tube, I'm going to draw up about 30 to 40 mLs of saline or water. I will then, like I said, if it's stuck, I'll do the plunging motion, and then I will push it in, and I want to mark that as INOs for my patient. When managing a tube, what would you include in monitoring and care for the patient? So I want to include, teach my patient that to call for help if they are getting up to go to the bathroom, just because to close off the tube properly, to make sure it's hooked back up. I want to teach them that to not lower the bed lower than 45 degrees because there is a risk for aspiration. What would you include in monitoring and care for the patient? I would include oral care for the patient just because they could get a dry mouth. So, and depending if they are nothing by mouth, maybe ice chips or popsicles would be okay. When managing NG tube, what would you include in monitoring care for a patient? And I think that's it. If I were to leave the room, bed rails up ×2, bed lock lowered, and call light in reach. So moving on to the NG feeding. What are some important assessments to make regarding NG feeding? How do you prepare the formula prior to administering NG tubes? So first you want to identify your patient with 2 identifiers, check for allergies to make sure they're not allergic to anything that the doctor ordered, perform hand hygiene just like you would do in managing. So all the 4 major steps that you do for everything. So you treat the feeding or the formula like a medication because it is ordered by the doctor. So when you get it, you want to look at it, make sure it's not expired, make sure it's exactly what the doctor ordered. So you want to compare it to your MAR. How do you prepare formula? So you want it at room temperature for the patient. So you will shake it. So you shake the formula, you want to get it ready. You will turn off suction. You'll hook the patient up to a pump. You want to prime the pump before you get it. You want to make sure you have the right tubing. You want to label the tubing with your date, time, and initials. You also want to make sure that you label it that it's NG tube feeding, not IV tubing. When you prime the pump, you want to make sure that when you're priming it, you just prime it until a little bit of the formula would come out of the end, so there is no air inside of it. You prime it, you feed it, or you place the formula into the bag, and you would look at your doctor's orders to verify the rate that he wants it, if it's a continuous feeding, if it's intermittent, I think I said that wrong. What are some important? For a patient receiving NG feedings, what would you include in the monitoring or care for this feeding? So when you initiate the feeding, you want to stay for the first probably 15 minutes just because there is a risk for a patient to aspirate. So you want to make sure you're there in case anything happens. For the patient receiving NG, what would you include in monitoring care? You want to mark this as INOs. Prior to feeding, you always check the placement before anything. First you want to make sure that I did this backwards, but first you would make sure the gastric residual volume. So you would check your hospital's protocol, and depending on how much they allow to have the GRV to be, you would either pull it all out, check the volume, and if it's within the limits, you can place that back into your patient. If it's not, you would hold it, call the doctor, and see what they wanted to do. But if it's within the limits, put it all back. Monitor that that's still your INOs, so that's there. And then you would start the feeding and monitor how much goes in and out of the feeding. So do the GRV. Like I said, your patient can't be lower than 45 degrees on the bed. You want to have them call if they're getting off, so you can make sure that the feeding is stopped, or hook them back up to suction and make sure everything is started properly. You want the bed rails up ×2, bed locked, lowered no lower than 45 degrees, and the call light near the patient. I think that's it. NG removal, what are some important assessments to make regarding NG removal? What are the steps to removing an NG tube? Well, first you have to make sure that you have the orders to remove it from your primary health care provider. So removing the tube is the easiest part. You want to make sure you have a towel with you, just so you can catch any mess or anything that comes up out of the patient and doesn't get in you or the patient. You want to perform hand hygiene, all the steps above. Verify your doctor's orders, make sure you have the right patient, make sure check allergies, provide privacy. So when you remove the tube, you are just going to have your patient take a deep breath and hold it, and you will just pull out in motion and wrap it in the tube. You also just want to make sure that the end of the tube is still intact. If not, usually the doctor will say, okay, it'll pass in a bowel movement, but you want to report if it's there or not. What will you include in monitoring care for the patient who has just had an NG tube removal? You want to provide oral care for them. You want to assess their if there was any skin breakdown in the nose. You want to see if they can have anything to eat or drink after the tube. What will you include in monitoring care? I think that is everything. Make sure the bed's locked, lowered. I still wouldn't put them below 45 degrees because they just got the tube out. I don't know if they're still at risk to aspirate. Lock lowered, bed light near, bed rails up ×2. Share with your care group leader what you are thankful for this Thanksgiving. Oh, and when I'm checking placement, I want to make sure that it's not coiled in the back of their mouth also. That came to my mind. So things that I'm thankful for this Thanksgiving. I'm thankful for my children's health. Despite everything going on, my children haven't been sick or affected with the coronavirus, so that's something I'm thankful for. And that they're still in school, so I am able to do my virtual school at home and not theirs as well. I'm thankful for my family. I have a really good support system that's been there since nursing school, so they always help me when they can. In what ways has your care group leader influenced, inspired you to be the best nurse you can be? I think you are very bold and very, not intimidating, but you stand firm and you just know what you're doing, and it's very admirable to see how confident you are. And so I hope that's something I can display when I am a nurse. And I think that's it for my video. Thank you.